You're
Hi,
good. Hi. Nice to
how
meet
are
you
you?
because I've only ever messaged you like here and
No,
there.
literally. Nice to meet you too. I'm just gonna go out and say it. I've been like fangirling over your stuff for so long.
Well, I
Um,
appreciate it. I'm
no,
not that
literally.
cool.
Well, you're cooler than me, so.
We're cat labbers are easy to that's my dog.
My
Easy
dog, yeah, if you
to
hear
get along.
random like snorting, my incredibly clingy dog is just like sitting right under my phone. So,
I got the same thing. She's like, "You
yeah.
put me in jail. Why'd you close the door?" She likes all the doors options. She likes all her options open,
Yeah.
but we can't be having that. So,
Yeah.
because I mean, I know a little bit about you, but it should be recorded. Priya's worked out well. So just do
Okay.
an intro about yourself because not everybody knows what a CVT program is, how long it is. So you don't have to like
Yeah.
advertise the school if you don't want to, but just tell us a little
Yeah.
bit about your journey if you don't mind.
Yeah, so I actually graduated from a 2-year associates in applied science program just last May, and I didn't need like a bachelor's or anything for that. I basically had like gotten my associates in arts, originally wanted to be an occupational therapist, and then could not afford to go to a 4-year university, and that was like on me to pay for that education.
Yeah.
So then I worked in the hospital system doing patient transport and started talking to all the different departments and somehow ran into the cath lab. And they're like, there's a program in this city for that at a community college. And I was like,
Obviously
that's,
not. I don't know that, but
I was like,
thanks.
yeah. So I actually originally applied to the echo track because they had like an invasive and a non-invasive track. So I applied to echo and I didn't get in. And so I was like, okay, well, I didn't, there was only like what, 10 spots in the
Hmm.
program. Um, so I ended up actually going to EMT school and I was an EMT for like about a year. And in that time reapplied, except realized that I actually really like fast-paced team-based medicine. So I was like,
Yeah.
okay, I don't think that like echo is gonna be for me. Super interesting, but I was like, oh wait, if I can literally go into the cath lab, find something, and then like fix it right away with the whole team,
Did you know what the
obviously.
cath lab was when you had applied for the non-invasive, or were you just not really sure what the invasive
No.
track really was?
No, so actually, let me correct myself. My original connection was actually through the echo side of things.
Okay.
And I did go as transporter, like the cath lab kind of picked up their own patients. So I didn't really go in there
Yeah.
very often. And when I did, I had no idea what they actually did in there. I didn't even know it was cardiology related. I kind of assumed because it was on the cardiology floor, but that was like the
But you wouldn't
only.
know otherwise. I mean, you're not really
No.
seeing what's going on, and like every procedure area kind of looks the same, you know?
Yeah.
So your
Yes.
initial connection was echo, but you're right. When you're
Yeah.
even as a transporter of, I have like medics who come in to observe. If nobody's talking to you, like you don't really know what's going on. So I get
No,
that.
and I didn't really learn about the cath lab and the importance of it and what they actually did until I went to EMT school. And then you learn about STEMIs there.
Hmm.
And then I started working and I worked in like the middle of a busy city. So we were going to the cath lab often,
Yeah.
like, yeah. So then I was like, oh, I now I know what a STEMI is. I know how to identify some rhythms. And then personally, like my family has some history of cardiac events. And so I was like, if I can go into a field that gets to help people not have to go through maybe like what I kind of went
Hmm.
through, then of course. And then I can also make money doing it. And I also don't need a bachelor's and I can't afford a bachelor's right now. And so long story short, found out about the cath lab and this other track, applied and got in, and realized that, like me, most people applied to the echo side and didn't even realize that the cath lab side was like an option.
Correct. I
Yeah.
honestly, I thought they were kind of the same thing until I did clinical. Like I didn't really understand even though they say it,
Yeah.
you if you aren't in it, you don't get it. You're like, I see the words, but that doesn't tell me what you're doing every day.
Yeah. So I think even reading online the difference and then even being in class and learning how to prep a
Hmm.
sheet, like in my first semester, we had at least two classes with like the echo side of things. I still really did not even know what I was getting myself into until I went to clinicals. And then I was like,
Same.
oh, I was like, okay, this isn't that hard to explain. Why did nobody tell me? I know for me, it was kind of like, okay, I could scrub, monitor, or in some facilities circulate. And I was like,
Mhm.
and then you assist the physician. I was like, that's pretty,
Yeah. And my
I
new
say that
thing,
now, but
my like
yeah.
last year of teaching during orientation, but when people were considering the program, I would show a live case from YouTube and point out this could be you. This could be you. This could be you. Look at what these people are doing. Because I realized when I was scrubbing in, assisting the physician, they're like, what does that mean?
Yeah.
Like, how is it different from surgical tech, or how is it different from what I'm seeing in Gray's Anatomy? You don't know unless you
Yeah.
see it. And I was the same way. Like, I had 2 classes, or I had a year of class before clinical, and I was so intimidated by right heart cath because I learned hemodynamics
Same.
first. I was like, and
Yes.
my first case, my preceptor was like, "Do you want to scrub this right heart cath? It's so easy." I was like, "No, I'm not ready for that. I don't
Yeah.
think I can do it." And he was like, "Why are you so stressed out?" And I was like, "Because hemodynamics is so hard." And he was like,
Yeah.
"It's the monitor. You're just doing the catheter and the wire." And I was like, "Okay, but don't ask me
Yes.
questions. I
Yeah.
don't know what I'm talking about." But and then that was like the easiest thing. But to me, that was so hard, and like I wasn't worried about any of the other stuff, and now that's so
Mhm.
embarrassing. Where I'm like, I was scared to do a right heart cath.
That's why I talk to, so we have at least one, two new hires right now. And I literally tell them, do not stress yourself out over this. Like, I was like, you're going to. But like you're gonna look back, you're gonna laugh on it. And I'm like, it's okay. Like you don't need to know it all now. Today, one of the physicians asked me a question about something, and I was like, here's my thought process. And then he was like, you're right, and you don't need to doubt yourself. And I was like, okay, cool. But
But you don't
I
know.
yeah,
Yeah.
I still tell new hires, I was like, the more you learn about cardiology, the more you'll realize you don't know. And I
Yeah.
feel like that's pretty much true for most specialties.
You're right. People do, and also it's like it's what sometimes the experience people project onto you. Like I really used to be scared of doing certain things. And so for instance, I know I worked for Impella, but before that, I did Impella as a student and I didn't really know what it was. We were just doing it in the middle of the case. The rep was there, told me what to do, put in this wire, put in this catheter, exchange out the wire, put this, and it was just like everything else you do every day. I didn't think about it. And then I went back to class and I was asking my professor, what is this thing? I didn't even know the name. I was like, what is this thing that I did? It looks like a pigtail. It's not a pigtail. She's like, you should not be doing that as a student. And I was like, whoa, is this a big
Yeah.
deal? But because that's how it was presented to me, it never intimidated me. Versus when you have people, you go, hey, so and so, can I scrub it on this case? And they're like, no, 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 it's a rotoblader. Suddenly you're scared of rotoblader. Does that make
That is
sense?
how it was for me with Rotoblader. And I'm kind of the person where I'm like, don't just tell me how to do it. Tell me the why. Tell me how
Hmm.
I get here. Tell me what's happening inside of the machine that you give me so that when problems happen, I can just like figure it out.
Yeah.
And
When you
so with
hear that noise
Rotoblader,
and you're like, is that a normal noise that I should be hearing? Is it supposed to be
yeah,
doing that?
yeah, no, I'm glad you brought that. I do need to go back and watch like this 20-minute long video I found on a, anyway, but Impel is one of those
So
things where one of the second years when I was a first year, he looked at me and he was like, the best advice I can give you is just it's all wires and catheters.
hmm.
Don't overcomplicate it.
Best advice.
Everything that you do in the cath lab, even down to the sheath, is some version of a wire and a catheter. And the
Hmm.
like wire needs to come first.
Yeah.
Um and yeah, so I was like, oh, that makes things so much easier. I went back and then like scrubbing interventions from there. I was like, this is so much balloons on, just understanding how the equipment worked.
Hmm.
I also couldn't wrap my head around what how the stints were created. Like,
Mm-hmm.
you
Like,
know,
are these all little things glued
yeah,
together? Like, what are we?
yeah. And then I eventually like started to figure it out. So
But I love
yeah,
that perspective, and he was right. And then
yeah,
when I ended up working for them, that's people would be so scared, and they're like, "I haven't done an Impella yet. I'm so nervous." And I'm like, "Have you done a sheath exchange? Yes. Have you done a
yes.
catheter exchange? Okay. Other than
Yep.
that, follow the instructions on the
Mhm.
screen, and you will be okay." Like there is a lot. You're right. Like how it works. There's a lot to learn about equipment
Yeah.
before or after the fact, but the physical doing of it, everybody is capable of doing if you're already have decent wire exchange, right, wire handling skills, catheter exchange skills. It's applicable to everything that we do. It's just, and like IR people, a lot of people say about IR, like, well, I don't understand all of this stuff. And I'm like, correct. You can do the procedure and not understand it, but it's a wire catheter and hook it up to something, right?
Yep.
So I
Yep.
totally.
I think with half of the equipment too, I've
Love that
noticed like,
approach.
you look at it, if it needs something that needs to be plugged in, well, sometimes you can look at one end and then look at the other and realize that one end won't even fit into the body.
Mhm.
So penumbra, like you can't
Which
put the
way does
second
this
side into
go?
the body. Yeah, yeah.
That's a very good point. Yep, penumbra.
Yep.
Sometimes with the balloon pump connections, people get overwhelmed. I'm like, only one thing connects here. Nothing else will, so it's okay. And if it
Yep.
doesn't look like it belongs to you, then it belongs to the circulator.
Mhm.
If
Yeah,
you have nowhere to put it.
I've only prepped balloon pump. We've never used balloon pump.
It
We love
honestly it was
Nutella.
what I was most intimidated about because we rarely used it. We used it maybe once every 3 months and it was on call, right? So, I
Mhm.
mean, every time I had a respiratory therapist who took a lot of call and he was very familiar with it. And even if I was scrubbing, I would be like, this right. Because, the physicians, patients coding, whatever, they're not paying attention to you. And I'm like, I know all of this is going to go one way. I'm just going to fumble, just look and make sure I don't royally screw this up,
Yep.
you know? But that's going to happen no matter how experienced you are. You're going to have something you're like, I haven't seen this in a while. I kind of forgot.
Mhm.
And you want someone, you'll like fumble with it, right? But you'll want someone to just look and double check you. And sometimes that person's like, you know what, man? I haven't seen this in a long time either. So we're going to learn it together.
That
You're like,
happens. Yeah,
cool.
especially when it's stuff like we don't at our facility we really only use rotablator for 4 times a year. I would say the same with laser, but I've used laser like 4 times this year so far. So but it's definitely one of those things where I kind of wish as a new grad I knew that even experienced people are like, we haven't seen that in forever, or I've been doing this for 30 years, yes, but half of this equipment was new to me five
Yeah.
years ago anyway.
Yeah.
So it's just a little bit comforting because you're like, okay, we're all learning this together. We're still going to do it safely. And the physicians get such more in-depth training than we
Hmm.
do on some
But
of
they
these
get
things.
anxiety about it too, because sometimes
Yeah.
they haven't. They're hoping you've used it because they haven't.
Yeah. Yes, we have that
How
sometimes.
many of these have you done? Really means not, I'm worried about what you're doing, but they're like, I'm worried because I need you to watch me. So how
Yes.
many of these have you done?
Yeah.
So it's not you're right, it's really impossible to expect that you're gonna know everything and that everyone around you knows everything. I think the biggest asset is being able to take instruction at the table or literally can you open the IFU or watch a
Yes.
video and talk to like I have people call me all the time. They're doing an osteo flash. Do you know anything about osteo flash and how to prep it? Why? We're in the middle of the case. And I'm like,
You're like, I'm a rep now, actually.
yeah. Oh, got it. We opened the IFU. We're reading the instructions. I'm like, okay, good. As you should. I've had to do
Yeah.
that before, and a physician was
Hmm.
using like an N tier, which is a CTO device that we had
Yeah.
never used before, and he was like, "Do you know how to use this?" And I was like, "No." I said, "But I can redo the instructions, and we'll figure out what hole is for what
Yep.
together. It's not an emergency. If it's not an emergency, we can walk through it together."
Yeah. We did that with a snare the other day. So.
Yep. See, and it's like I get the gist, but if I haven't had to use it, I'm not going to be super confident in being like, yeah, I got this. And be like, can somebody
Hmm.
please pull out the instructions for a second and
Hmm.
just make sure we're doing this right?
Yep.
Like I think Rhoda and Diamondback CSI are it's a little harder because it's a little more in depth, but you can I had when I was a rep, I had so many people FaceTime me that like they don't necessarily need me there, but they just have a quick question. And I'm like, the
Hmm.
glory of FaceTime. You can just FaceTime me and ask me a question. Show me what you're doing. Let me see. I'm like, no, that doesn't go there. So how many you are employed now? Yay,
Yeah.
congratulations.
Yeah.
So you've been there since for almost a
So,
year?
yeah, for about a year. So I graduated May 15th and then I got the job January of my like final semester. And the way that that's a whole other story. But which we can get into. But yeah, I ended up actually like starting work early June.
Hmm.
So I graduated and then went
So it
straight
was
in.
the place that you did clinical at?
No, I actually moved states. Um,
Oh, I did not know
yeah,
that. See, new
yes.
news.
So I was in one area and oh my gosh, I absolutely loved one of my clinical sites. And even now I keep up with them and they're like, if you're ever back in town,
Yeah. I
come
think
work
that's a
with
good
us.
relationship to have.
Yes,
So you
I
really you had to do did you do a lot of interviews where you thought you wanted to go? Or you just you only did
um
one and you ended up working there?
no, so I knew exactly what city I was moving to because I got married, so that's why I was moving. And they only have one cath lab that's within like 90 miles. So I was like, okay,
You better
well,
hire
I'm
me.
getting a call. So this is either going to work or it's not. So I only did one actual interview and it was over the phone.
Oh,
It
that's
like I did,
hard.
yeah, I did an initial one with HR like over the phone. And then I did a follow-up one with Cath Lab manager.
Did the manager have you on speaker with a group or they just did it
No,
themselves?
I thought they would.
I thought they would too.
Yes. So the facility I'm at now was in a like a management transition period. So the cath lab manager was actually like one of the more so ICU nurses who had only been
Hmm.
in the cath lab for like a month or two. It was,
Not
after I got
uncommon.
hired, I realized that I was actually hired during a massive employment transition period. My dog is trying to
Oh, hi.
invade my personal space right now, buddy. Off.
You're welcome here anytime.
He's very interested in the cath lab today. That's why I'm very passionate about the interview process because you definitely have to ask your questions. And I like the
So
lab I
yeah,
work
you
in
didn't
now.
know
I
until you
didn't. And
started.
they were good changes. I just didn't realize how much change was happening.
Yeah.
I kind of guessed because I got hired in like 24 hours and I was like,
Red flag.
really? Yeah,
Red
I was like,
flag,
either
but I
they
need this too.
absolutely love me, um, as somebody who's not even graduated from the program and does not have their RCIS yet, or they
Oh,
really
that's
need
true.
people. Which I think it was a little bit of both. I think they did like me and I do fit in well with the team. And a good thing about our team is that it's a lot of people who have been there for a few years and they're hired on staff. So me coming in as a new grad was fairly like seamless because I
Mm-hmm.
just had so much support. There wasn't any travelers at the time, which no, nothing wrong with travelers. I like travelers. I learn a
But it
lot
is a
from
red
them.
flag if a place has a lot of
But if
travelers
they
and not
have
a
a lot
lot
of
of
travelers,
experienced
yeah, it
staff.
does kind of communicate like, hey, we struggle for staff. And so we
Yeah.
have people come in and out. And ultimately, like, no matter what you think about travelers, that does change the culture in the lab. And it does kind of make it more difficult for you as someone who's a new grad to have some more stability in some of the things that you're learning and how they like to do it at their lab. And so
Yeah.
I
Either
really,
you have a
yeah.
traveler who has taught before and
Mhm.
understands where you're at. Like, because some people don't have never experienced a student, like a CVT student, who
Yeah.
kind of knows things but needs certain gaps filled. Or you have travelers who have never, have just always been at places without needing to train anybody. So it depends. And it depends on the patience of your physicians also.
Mhm.
You know, if they're
Yeah.
like, yeah, we have new people all the time, like I'm used to training. Or there's people I've had who were like the one new person in the last 6 years, and none of the physicians had patients because they've never really experienced a new person.
So that was me. I was the guinea pig. Um,
Yeah. Oh.
so it I learned a lot. But yeah, so the lab I'm at now, they did have a program nearby that kind of like ended up staffing their lab, and then that program fizzled out. And so another reason why I'm really passionate about like getting the cath lab out there because people when people don't know about the program, they didn't go into the program,
Yeah.
and then now the cath
That's
lab
good.
is like kind of relying on the people that have been there for it to stay staffed, which is okay for now. But anyway, the
But you don't want to
physicians
be
and staff,
blindsided when you get hired,
no,
for
no,
sure.
yeah. And the physicians were new to like teaching again. A lot of them hadn't taught in a while. So that was a little bit of a learning curve for both of us to like just, I had to learn how they taught and they had to learn how to re-enter like teaching someone because I wasn't a student anymore. Like I am there, which I think is also a big difference because as a student, it was like if you don't take initiative and show the physician that you're there, then
They
they're
don't care.
probably not going to invest very much in you. Yeah,
Yeah.
because they're like, you're not here for that long and we don't need you in this lab. Like you are here because we want it to be a clinical site.
And
Uh,
unfortunately, some students make the mistake when they get a job of saying that and like kind of bragging about that of like, oh, well, I'm good because, I have this job here for me and anything can happen, right? Like they can always rescind that job offer. So you never want to say that and get cocky because then your current clinical site is like, well, then we don't care about you anymore. Like there's
mhm.
no chance she's going to work here. So why would we?
Yep.
Some people will teach anyway, but some people will withhold opportunity because, well, she's good. She has somewhere that she's going. So we don't really care
Yes.
about her, unfortunately.
So if I had stayed in the city where I I was in 3 labs for clinicals, and it's a small world. Like
Yeah.
people know people even outside of that city. One of my instructors was a traveler at one point, and she was like,
Mm.
"Oh yeah, I worked in this other place, and I saw a tech there that was doing traveling, and we had worked at a travel contract together in Colorado or like some other random like state." And I was like, "Okay, so
It is
basically,
a
like,
small world.
yeah, be yourself, but also be considerate and
Hmm.
um."
Yeah, and you
Yeah,
can't,
so don't take
you know,
advantage
lie
or
in your interview because they're gonna text so and so and no, you know,
yes. That was
you
one of
can't
my
be
I
making
like
up stuff.
so I made a few points like on interviews and stuff. I think it's in my notes app, so I actually don't know if I can access that from here. It'll probably come up though through conversation, but that was one of my biggest things that I would recommend to any new grad is like I know you want to put yourself out there, seem like a perfect hire, but do not lie about your
Hmm.
experience. Do not say you have peripheral experience if you do not have peripheral experience.
Yep.
And for me, the example I could give is like I had very little manifold experience and very little experience panning a table or manipulating the x-ray. And then the facility I'm at now, we do both. We don't have the assist at all.
Oh,
Um,
that's why, because you had to
yeah.
use the assist a lot. Oh,
Yes. And then we move the II, we set up the patient, and then we pan as well. So all of that I was learning on the job basically. But I think they just appreciated that. I was like, I don't, I'm not proficient in that.
I would rather people be honest because you also have to remember, especially if you interview in a different state, they don't, unless they've been travelers, they don't necessarily know what it's like in other states and other labs. I'm sorry if you can hear this absolutely insane thunder outside, but it is so loud. But you have to articulate that. You can't assume they know what your experience was like, and they
Mhm.
can't assume that you know something because they're going to assume like, oh well, you went to a CVT program, you should know this that and the other. But not all CVT programs are equal either, so
Nope.
you have to be honest with what you learned and what you didn't learn,
Hmm.
and that's
Yeah.
on you to communicate. They're not going to know unless you say something.
Yeah. Yep.
Sorry, this is very bright. Okay. So I did write down, and I'm guessing because you had more of the CCU, ICU manager interview you, they did a very formal interview of like traditional interview questions. Usually
Yeah,
they have to follow a suit, but not everyone does.
they didn't ask a lot of questions about like more in depth about experience,
Hmm.
and I gave them that information.
You were just like, I practiced this, so I'm gonna bring it up.
Yeah. They kind of did ask like, oh, like how much time did you spend in clinicals and this and that, and I told them I was like, I do, PCIs independently or this or that independently, or I need work here, but um, yes, it was more like formal, I would say.
Yeah, I would say when people ask, what do you say when they say, tell me about yourself? Because that's always like the first question
Yeah.
is introducing yourself.
Yeah, I think I gravitate to want to talk about like my work experience because that's what like I'm
Mhm.
like here for. But I try to make an effort to talk about like, well, here's what I also do. Like I love working out. I love training my dog. I spend like a lot of time training my dog. I bake. I have a little sourdough business in town.
Oh, I love
Um
that. See, that's
yeah,
so much more interesting than telling me about work.
yeah. Yeah, I'm like nobody really wants to hear about like my transport experience. Maybe what I
It
learned.
can be relevant in other questions, you
Yes,
know.
yeah.
But I
Um,
agree. The intro is who are you as a human being? You know, if you're moving, why are you moving? Like, is it because you couldn't get a job at any of your clinical sites? Like, that's a good time to bring that up. Of like, I'm looking to relocate because I
yep.
just got married. My husband just got a job here. I did have a job offer at the clinical site I was at, but unfortunately, we are looking to move by this day. Like, that's normal to bring up because
Yeah.
I want to address the red flags. Because if you're coming to me from a different state and I'm like, what's
Yeah.
wrong?
Yeah.
What
So yeah, I
happened?
did tell them that. I was like, well, I'm getting at that point I was engaged. I was like, I'm getting married in August and then my husband already lives there, so I'll be moving up there when we get married and then yeah, so I was like looking into cath labs and I found you guys and that was kind of after I'd given a little bit of a
Yeah,
spiel. So then they were able to be
that's
like,
good.
okay, moving to the next question. And
That's good
yeah.
because a lot of people, even within your area, right? Like, let's say you interviewed at one of your 3 clinical sites. If you had some kind of issue at a different clinical site that's relatively publicly known, through the rumor
Mhm.
grapevine, you want to address it. They're not going to bring it up because usually legally they can't. But
Mhm.
if I have reservations about you because of an experience, or you had a really bad experience with a physician and that physician now works at this hospital, or you had this big issue, or let's say you failed. Let's say you failed out and you had to recycle,
Mhm.
bring it up because you want to be able to plead your case and address it and not look like you're hiding things. Even though it's uncomfortable to do, you want to command the story.
Yeah.
If that makes sense. So they're like,
Oh yeah.
moving is always a red flag.
Yes.
If you like applied to your 3 hospitals and you couldn't get a job, like I had a new grad who was like that and just made a few mistakes. And unfortunately, rumor gets around, right? And it makes it
Mhm.
difficult for you to get a job. And I told them, I said, look, your next interview, you need to address it because they already know. So you need
Yeah.
to say, look, honestly, this one was my top choice. I made some mistakes. I'm looking to learn from them. This is what I feel like I can offer your team, what your team can offer me. I look forward to, growing, becoming more of a professional, whatever.
Mhm.
Anything that you do addressing it looks better than just leaving it open ended and them hearing they're going to call the other people, right? The other traveler that I worked with, the rep who covers all of the hospitals, and be like, well, why didn't you guys hire them? That's what they're going to
I have
ask.
heard of that happening within my own class that happened. And that person ended up getting a job. I don't
Mhm.
remember how their interviews went. I didn't speak to them personally about it. But it is one of those things where I would say, like, in my own experience in clinicals, you're like, I was at 3 different hospitals, and you're just not going to click with every
Yeah.
single cath lab you go to. There's one site that I just didn't click with. I think a large part of it is like I'm young, I'm 23, and then the whole clinical site was like in their 50s or at least late
Yeah.
40s,
No
and the
commonality.
conversations were just so drastically different. So there was a few like moving pieces to it, and I ended up actually switching sites because of like a one of the employees at this clinical site overstepped boundaries, and I ended up reporting it. It became a whole thing, but
Yeah.
that became publicly known, right?
Yep.
So it's like
Yep. And
now.
let me tell you, from a professor point of view, this is why I rarely moved students unless it was something really bad, because it's always the student's fault. It's so hard for you to tell your
Mhm.
side and for the community to believe you first,
Mhm.
unfortunately. Because you don't get that opportunity, right? They're like, well, they're a student, they're a guest, and I know this person and they've worked here for this long. And it's hard to, but that is something in an interview in that area, right? Not like in another state, but in that area, you're going to want to address, like, why did you move sites
Yep.
in a political way?
Yep. And I actually spoke to the new site I ended up going to. I spoke to the manager there, and I was like, hey, like, this doesn't need to become a whole thing. I just want to let you know, here's what happened. Here's how I felt about it. I know the staff were probably like, that's just how that person is. And I was like, that's great. But that crossed a personal boundary for me that
Yeah.
I'm not willing to, let up on. So that's why I'm here and I'm ready to learn. And then the manager was like, great, sounds great. Let's get at it.
Yeah.
So yep.
But
And
you
it
addressed it versus
yeah,
letting everybody else fill in what they think happened.
yes. Yeah.
Yeah.
And that I think just made the transition a lot smoother, and then I could
Mhm.
focus on learning. I didn't have to have this in the back of my head like, what
What
if
are
they
they
find out? What
thinking?
are they
Did they
gonna think?
know?
Yeah.
Yeah. No,
Yeah,
and
for
that's,
sure.
it's tough because as a student, you're going to have conflict, right? Like, things are going to happen. Sometimes it's going to be bad enough that it does get escalated, and you want to be mindful. It's your reputation, and you're in charge of your
Mhm.
reputation, and how you want to talk about it is how you want to talk about it. But you're right. Then you want a better experience at this place. I think the right thing to do is go to the manager, and then when you have a preceptor, tell the preceptor what happened so that they're just like when you're telling your instructor what happened, like, they can defend you if they have all the information. But if they don't have all the
Yes.
information, you're new. They're not going to be like, Emma, tell me about this thing that happened. Like, that's a little uncomfortable
Yeah.
for someone to do. They don't
Yeah.
know what actually happened, and they don't know if you're okay talking about it unless you bring it up.
Mhm.
So
Yeah.
I think that was the right thing to do.
Yeah.
Did you what questions did they ask you? Do you remember in your interview?
I remember mainly them asking me like kind of some of those like questions that test, certain things. So like
Conflict
what's one
resolution.
time, yeah, or like what's one time, yeah, that you had a conflict and how did you solve it? Or I think there was another one where it was like, I'm trying to remember the specific
I've
question.
gotten weird things like if you were to be a,
Yeah.
a, a piece of silverware, what would you be? Or a
They
utensil,
weren't
what
okay,
would
they
you
weren't
be? And
that
I'm
out
like,
there.
a spork, so I can
Thankfully.
be versatile. I don't know.
Yeah. And I'm like, I don't know, a spoon? Like
Yeah, I've been asked that many times. Like, I've been
really?
asked if you had to find a needle in the haystack, what would you do and tell me your strategy? I'm like, what? Yeah.
Okay, well, apparently I haven't been preparing for interviews correctly because I didn't know that was.
Those are very corporate questions.
Yeah, yeah. No, I had one question that asked, I had a specific story prepared of,
Mhm.
I think it was something about like, what's a time when you've been challenged, basically make the right decision or something
Mm.
like that.
An ethical
Um,
dilemma.
yeah. And I was in a position like in patient transport where I'd gone back to patient transport after EMS while I was in school, and I was like primarily in the emergency department. And so I had a situation where like my job, I took patients to like radiology, and that's what I did.
Hmm.
And then back to the ED. I had a patient actually go into VTAC in CT. And
Oh,
then the techs are not, I guess in that facility didn't need to be ACLS certified for CT. And I don't even know if they need to at most facilities for CTs. But I was like, that's monomorphic VTAC if I ever saw it. So, the nurse for this patient was actually close by, and I was like, some of the techs were kind of like they're fine, he's fine. And I first thing I like jump into go mode, and I'm like, I know that I'm just a little transporter, and these CT techs who are like above me are telling me like it's
yeah.
not a big deal. And I had to make a decision. Am I going to do something about this, or am I just going to be like, okay, well, I'll just take them back? And I decided
I'll
to make
just
a
transport them
decision.
in
And so
PT.
I take kind of don't take over because I go, I'm like, first thing, check on the patient. Hey, are you feeling okay? Looks at me, shakes his head, like, no. He is diaphoretic, like he does not look the
Oh
same as when I
no.
brought him. First thing I'm like, how long has he been in this rhythm? They're like, oh, the beeping started when we started scanning his head. I'm like, okay, good to know. And then, check a femoral pulse, not a grave femoral pulse. So I'm like, let's get rolling. So
Yeah.
then the nurse was right around the corner. And I was like, hey girl, so your patient's in like VTAC. She runs in. He's still conscious, like everything. And I was like, I just wanted to be on the safe side. She starts running through kind of like the procedure that she needs
Hmm.
to. That patient ended up actually coding, and they worked on him for 30 minutes and got him back. And then the hospital ended up giving me a award because they were like, if you hadn't caught it as early as you did, he would have probably had neurological deficits, or we wouldn't have gotten him back. But we got him back, and he has no neurological deficits, and he's completely recovered. So I use that as like an example of
That's a good
like, and that's such an
example.
extreme example. It doesn't need to be that extreme, but I did use it as an example where it's like advocate for the patient. Also, don't
Yeah.
just go off the monitor. If you got a feeling about something, maybe follow it or ask for advice or
Yeah.
ask questions out of curiosity, not like a, I'm telling you kind of way. But yeah, so that was
Right.
one of
Because you
those
weren't
like.
over, I mean, it's chain of command, right? You were doing the right thing, but even if you feel like you still disagreed, you had a right to ask. Look, Shauna's very happy. Shauna was one of my pressers. She runs the Don't Miss the Hiss page. She said,
Oh,
yes, patient advocate.
yeah.
You preached that. And even if, let's say, right, you're interviewing and you don't have something that resolved in the way that you thought it should or wanted to, it's still a good story to tell, even if it was nothing,
Hmm.
right? It's still a good thing to say and say, you know what, I felt like it needed to be said. I said it. It ended up being nothing, but I'm glad that I said something anyway. That's still a great answer to that question,
Yes, I
to
agree.
prepare
Yeah.
for.
That carried well into the cath lab, that mindset. Because now, like, say you have a femoral groin access situation going on. And there's times now where I just know that I'm not as experienced as some other techs are. So if
Hmm.
I'm unsure about it, I do say, hey, can I just get a second pair of eyes on this? Can somebody
Yeah,
else check this for me? If
wrong with
the,
that.
yeah. And then, sometimes I do get the like, girl, like this is fine. And or they're like, stop
Yeah.
doubting yourself, it's good. And I'm like, you know what? I'm glad I checked. Yeah.
Yep, that's like, I'm like, you're damped, and they're like, we know, and I'm like, I
Yeah.
know, and I'm gonna tell you anyway.
Yes. Yep. Yep.
Not hurting you by hearing my voice for a second.
Yes.
Calm down.
But for new people going to the cath lab, I think that question in particular is so important because now that
It's a
we're
big
talking
one.
about it, I realize how many times in a day where I do kind of say things that follow the guideline of trust but verify,
Hmm.
where, I trust that, yeah, you're probably open on the TUI, but also, you know,
What if you're
doing
not? I
something.
can't really see
Yeah.
you from the monitor.
Yeah.
You're
So,
just assuming, right? But it's your
yes.
job to say it. It's their job to verify. Exactly.
Yeah.
And be like, oh, sorry, I'm open. Cool.
Yeah.
Fix it.
Yeah.
But I agree. And I think as from leadership perspective, it's a good question to add to your repertoire to ask. Even if they haven't had a big moment, but you learn a lot about who they are and
Mhm.
are they going to be someone who speaks up? Because especially if they have patient care experience, you can't tell me that they have never had never had an instance of patient advocacy. If they haven't, it's because they're not a patient advocate, probably, or they're just like, well, I'm just
Yeah.
clocking in and doing my job, but there's a million mistakes that happen in a day, right? There's a million of almost of catch this of, oh, is that this? And it ends up not being that. But if you're working in healthcare, you should constantly have those experiences, right? And if you don't, why not?
Yeah.
Because
Yeah.
I know something's happening. I know you saw something weird in a patient's chart, right? Or their sat probe came off and they're satin 0, right?
Mhm.
And you went to go look at it. Like even that small little thing, that's a patient care thing and a double checking, not just assuming, well, the probe probably came off
Mhm.
or not.
Yeah.
Right? What if
Yep.
not? Did they ask about or did you prepare for the strengths weaknesses question? I feel like that's quite kind of a
Yes, they
common
did
one.
ask about that. I think for weaknesses, I actually looked up how to handle this conversation because I was like, I know they're
Oh,
gonna ask
good.
about it. And I told them like one of my weaknesses is that especially like coming from this kind of like perfectionist mindset is like I do want things to be perfect and sometimes I don't always trust that I'm gonna get the help that I need to do certain things so I try and do it all by myself. So I'm like, but I recognize that the cath lab is a team sport, like that you have to be able to rely on other people. And
Hmm.
so something that I am conscious of is that it is a weakness of mine to want to try and fulfill every role, but then I was like, well, that's why I function well in the cath lab is because as a scrub, I can rely on my team and I know exactly what my role is though, and I can fulfill my role.
Right.
And then we can really help each other that way. So that's how I handled that conversation.
I like that.
Um,
And I always say we all have weaknesses, and if you have to prepare for it,
mhm.
right? Because sometimes we can like ramble on what our weaknesses are, and you shouldn't really do that in an interview, right? But
Yeah.
you have a couple that you need to work on, but you want of what are you doing about it? Or hey, I struggle with this, but I'm aware of it and I'm working on it, or this is how I'm going to work on it in this environment because nobody's perfect. We're all constantly working on things. But if you just tell me, like, I get a little lazy sometimes, and that's just kind of where you end the conversation, I'm
It's like,
concerned.
yeah.
Yeah, I'm
So it's like, I'm
great.
glad you're
Me too.
self-aware, but like, what are you doing
Right, right.
about it? Yeah.
Very
Yeah.
self-aware. That's a strength of yours. And that is a
Yeah.
strength. Yeah, mine was saying yes to too much and taking on too much. And
I
in the
think I
moment,
also said something like that too.
I probably I feel like a lot of cath lab people are like that because you want to help people, right? And then I would put it on my calendar, it all looks fine, but then like the week comes, I'm very overwhelmed and I took
Mhm.
on too much and I get overworked. So I had my little planner because I lived by my planner and I have to actually schedule in like self-care time, or I'm going to watch this show tonight from 7 to 8 when I get home, and I will have to do that, or I will fill it with something else, or I'll
Yes.
agree to picking up stuff, and I'm here for the team, but I also understand like I can only show up as my best if I'm giving myself the rest I need. So I bring that up for sure.
How I
So
actually wonder, like, I think for me, like, bringing that up would be kind of like a little bit of fear in bringing it up because I wonder if people would take that and they'd be like, oh, she might become a problem because she's actually going to set boundaries and we don't want
mhm.
that. We want
And
her
they
to give
could,
everything all the
but
time.
then it's not somewhere I want to work.
Yes. Okay, wait.
So
Yeah,
that's why
actually,
I don't hide. I used to, right? I used to hide too much of who I am. At the same time, like, you want to choose them. Now this is different if you were in your situation and you only have one option, right? You only have one option where in the location that you need, you gotta be political, spruce it up a little bit, like be super clean. If you have options, you do want to be a little honest. You want to learn about their team. You want to challenge them on the weaknesses in their team because you want to choose them as much as they're choosing you so that you're happy. Because reputation does matter. And if you're at a place that isn't a fit for you, it's going to come out in your performance and then you ruin your reputation that way. Does that make sense?
Yeah. Oh
So
yeah.
now I'm a
Yeah, that
little more
was
honest now than I used to be when I
yeah.
had experience. And I think experienced people have that privilege a little bit, right? Who
Mhm.
do have some options. When you're a new grad, it's a little harder, right? I was definitely way more buttoned up than I was in
Mhm.
interviews moving forward.
I think for new grads, it's like pick which things that you want to be honest about.
Yeah,
Don't sacrifice everything either, because again, you do want to like make sure that you're going into an environment that you're going to learn from and
hmm,
you are going to be better and that you're going to build a little bit of a rapport, or like, because then your next job, this is it, this is the job where you're going to take your references from.
correct.
And so it's like you do want to make sure that you have a good relationship with the staff and like what's going on there, and that you're actually going to learn something. So I think like going back to interviewing, like you're interviewing them as much as they're interviewing you. For me, like one of the clinical sites I was at, I wasn't even considering interviewing at, because I
Because of
was
your
like, I know,
experience.
yeah, because of my experience, and I knew I wouldn't fit in well with the staff. I also wasn't willing to move there. Obviously, like we're talking, it wouldn't work in my situation, but say I were to stay in the city, I still wouldn't have interviewed there, because I knew that there was, of the few values that I was going to like stand by, it would have crossed that. And so I was like,
Yeah.
then
And I
I
think
don't want to work.
as a clinical coordinator, I used to have this conversation all the time. And there are two big systems where I live. We had like 32 clinical sites, which is a lot. But I
Yeah.
understand the privilege that I had. But
Yeah.
it came with, well, I only have 12 graduates. Where they chose to work could sometimes be a problem. So like they would all choose to work at, let's say 9 of them would work at this hospital system and 2 of them would choose this hospital system. Then the one with the 2 comes to me and goes, Sam, why aren't your students wanting to work here? And I say, well, guys, you gave them a poor experience when they were a student. And they go, well, we'll treat them better when they're full time. And I was like, you lost your chance.
Yeah.
That was your impression. And even though you only maybe had one student, let me tell you, that one student told all the rest of them about their
Oh,
experience
for sure.
for
Oh yeah.
sure. And
Yeah.
that's just like that, that's their reputation. You don't get a second chance to do that. Oh, well, we'll treat you better. We'll give you more opportunity when you're hired here. That's not how that works, especially if they have options and they had a better experience somewhere else. I mean, they were paying $5 more an hour, and everybody else still chose to work for the other system
Yeah.
because they wanted a better experience. And they're like, they did so much for me as a new grad. Or as a student, they advocated for me. They really took their time, even though I didn't get time at the table. They did stuff with me off on the side to make sure my needs were met, checked in with me,
Mhm.
versus the other one didn't let them do anything and just wanted them to observe because the cases were too complex. They're not going to work there,
Mhm.
unfortunately.
I think that's the hardest thing as a student, is when you're at a clinical site that pretty much only wants you to observe, but
Hmm.
then you graduate and you're expected to know how to do a PCI.
Yep. And then I would get
And
that. They
yeah,
would complain and be like,
yeah,
oh, well, the last couple of people that we hired really weren't up to par. And I was like, let's look at what their clinical sites were. You. Their last place was you.
yeah. And they don't know what they don't know. You have to
Yes.
teach them. So
Yes.
yes, yeah. Actually, I did ask that, and I think we kind of talked about this earlier, but I asked that in my interview, as I was like, when was the last time you trained new people? You know,
Hmm.
just like I really wanted to get a feel for what I was getting into, especially because it was my only option. And my husband, we're moving again, like in a year or so. So I did know that if I absolutely hated it, at least I like would learn a lot and it was temporary. But I was like, I still really want to know like what I'm getting myself into.
Yeah.
And I think I straight up asked them, how would you describe the culture in your lab?
Yeah. I always
Something like that.
ask your nurse versus tech culture? Is it something you're struggling with, you're working on? Do you have good cohesion? Is it mainly a nurse run lab or a tech run lab?
Mhm.
And I pry on that a little bit because I know the type of culture I want and don't
Mhm.
want. And I also ask if they do like structural or certain things. I'm like, how do you
Yeah.
choose who gets opportunities to learn? Is it by seniority or is it by who's interested?
Yeah.
Because there are some places, like again, that one hospital system, it used to be by seniority. And it was, well, these are the only people that get to do that are the TAVR team. And,
Mhm.
you know, you have to be here for 7 years to have that opportunity. And I'm like, oh crap. Like as a new hire, I'm never going to learn that. Like when is my time going to come up? You know, I wanted to learn everything I could. So you're right. You need to ask some of those better questions. And you want to ask how many openings they currently have. Do they have anybody leaving
I
soon?
didn't ask that. I think that's something I wish I had asked.
Oh,
Is like,
everybody's leaving, actually.
yeah, yeah. So I actually found out after I got hired that when I got hired, they had fired, to put it shortly, but put off three techs and two doctors.
Oh
So
wow.
yeah.
I've only
Uh,
had that happen at one other place in our area.
yeah.
Well, it was like a mass exodus. They didn't fire them, but they all walked out.
It sounds like it was a good thing from the staff that I talked to now, and I do really love the team that I work with now. But yeah, it was definitely something I wish I had asked, like, what's it realistically look like? And so I did go into my interview knowing, like, I looked at the expectations that they had written out, and especially like
Mhm.
for call hours and stuff like that. And so then I confirmed through my interview, hey, I noticed this was what was posted. I just like to confirm, what does this realistically look like? Do we have the
That
staff to support
changes.
this? Or is this more of a goal expectation
That's a good
that you'd like
question.
to meet by hiring, me and or somebody else? At the time, they were pretty confident. Their call was good. I think by the time I ended up working, which wasn't until I didn't start until June,
Yeah,
um,
a
things had
lot can
changed again.
change.
So, coming out of orientation, by the time I got out of orientation, I was taking a lot of calls. That's not something that they could have anticipated at all. But I do think it's a good question to ask.
Yeah,
Is
and
knowing,
with in mind that it can change when you get there.
yeah, yeah, and just being okay with that. And that's something for me as a new grad, I am pretty much okay with, because I'm like, I did come to this facility like interested.
Get
It is a facility that
experience.
does structural and stuff like that. So I was like, I am excited. I get to learn new things. I get to learn peripheral work. I get to work with our vascular surgeon. EP is an option too if I want to.
Oh, you should.
I probably should. I
You've
don't like it.
you've
I like
started not knowing
pacemakers.
anything. You
I
don't,
like
the reason
pacemakers.
you don't usually like things is because you don't know it well enough yet
Oh,
to find
100%.
it interesting. You
That
know,
is
I used to say
100%
that about
why.
EP because the professor that I had at the time withheld a lot of information. So it never really made sense and I could never get interested. And then now, 9 years later, when I'm trying to learn it, I'm like, okay, I get it now. Like I see this thing and this thing, and this is kind of cool. And then I went and
Mhm.
observed a case, and it was just so much more stimulating than it was when I was a student. But that's because of the experience that I was given, you
I
know.
do think that eventually I'll probably do that. Like if I'm like, I don't really want to take call anymore, I'll probably go the EP route. And also, I've done a little bit in EP. I do like pacemakers because if I didn't go the route that I'm in now, I like surgical tech stuff. I was like, I
Okay.
an open wound, yes, please. Let's, yeah. Anyway, that was interesting to me. And then I got into like an ablation, and I was like falling
Because you don't
asleep.
know what's going on. I think if you're at a lab that involves you a lot and you get to learn, you get to run some of the machines, you get to learn some of the mapping, you'll probably find it a little more interesting.
Yeah,
Because
the
I get
mapping's
that.
super
If
cool.
you're not, if you're like, number one, you don't know what's going on and you look at it, you're like, what is this? Which I'm sure the same comparison are significant others who watch their significant other play a video game and they're
Mhm.
like, this is so boring. But the person playing the game is like, this is so great because they have
Yeah.
all these other things going on. It's the same thing.
Yes. Yeah. Yeah.
Unfortunately. Did
Yeah. I also did ask that you were saying about and I think this communicates really well, like that you want to grow, is when I asked about the structure things, or like what kind
mhm.
of more complex procedures do you do? Do you do CTO procedures quite often? Because those are things that I'm not like incredibly experienced in, but I am teachable and I'm very excited to learn. Like that's a goal of mine actually. I thought structural heart was just like the most interesting thing when I went through my program. And then I learned about TAVR, and I was just like, get me into TAVR. And then I
Yeah,
even had
that's
an
more up your
opportunity to like
street.
shadow an open heart surgery, which is
I was
crazy.
gonna say, if they have to go to a surgical valve, you're probably like, yes, can I stay?
Yeah. Yeah, so we actually
Can I learn?
do, we have TAVR days every like other Wednesday. And I'm usually on the interventional side or in vascular, which is fine. But eventually I'm like kind of like, if we have enough people this coming week to
Yeah,
have me over here training, I
keep
would be
asking.
very interested in that. And they're kind of like, okay, okay. Well, so I'm working on it. But I did say that in my interview. This isn't a specific area I'm interested in. I knew or I learned that the hospital would be implementing the mitral valve clip. So then I was like, okay, so
I need
basically
to bring
this
this
is
up.
yeah. And so that was good. I think that communicated, that okay, she's new, but like she knows to an extent what she wants and where she wants to grow. And
Yeah, you
especially
always want to say you're open to learning because some people make the mistake of going somewhere interviewing and being like, I'm interviewing here because I don't want to do structural, and they do structural over here, but they're trying to build a structural program. And they're like, oh, well,
yeah,
we're not going to hire them because
yeah,
they're just going to leave when we start the structural program. Like, you don't know what they have coming in the pipeline,
yeah.
right? You don't, maybe
Asking
they're
that ask
introducing
yeah.
EP and you go in and say, and they're asking you casually, oh, what are your thoughts on EP? And they're like, oh, I'm a cath lab, or I hate EP. There
Mhm.
and then they're like, well, next year we're going to start with an EP program and need to cross train our cath people. So we don't want that person because they're not
Yeah.
going to want to do it. Right. You
Yeah.
never know what's coming down the pipeline. You don't want to say you hate anything. You can have preferences. I always say I don't, and you don't know. It's like you're not trained in it. You don't know if you love it or hate it if you
Yeah.
haven't really given it a chance. Right.
Mhm.
So you don't know what you don't know.
Yeah.
Don't
Yeah.
shoot yourself in the foot before
Yeah.
you get in there.
No, especially because I feel like EP is, I think I was talking to one of our EP physicians at one of my clinical sites, and he was like, I think I did more years of everything combined, med school, residency, fellowship, all of that. And he's like, I think it's the same or longer than like neurosurgery. It's maybe not longer. I don't know, but it was a lot. And I was like, I think he did like 12 something years. And I was like, there's a
Yeah, I think,
lot
I
to
don't
learn.
know, and someone can correct me, but I don't know if for EP you have to do general cardiology in an interventional program first before you do EP, or if you can do just an EP based program. Because
Yeah,
then they might have to do like 2 more years than an interventionalist. I'm not sure. Someone will
I
correct
don't
me on
know.
that. But I did learn from Priya that pretty much every program's structured a little differently. And some give you exposure to all, but some don't.
Hmm.
So then you would have to go do something specialized after that,
Yeah.
which ends up being longer. And so for the I will say there's like always a conflict resolution problem, an ethical dilemma problem, which you brought up,
Hmm.
and then like chain of command. So they always ask like if you have an issue with a preceptor or an employee, like a coworker, what are you going to do? Number one, number one, they always want to see if it's in the middle of a procedure, like you're at the table, you don't do it in the moment because the patient's there. So they're always looking
Hmm.
for, do you remove the conversation from the patient? So like when it's done, we go in the hallway
Hmm.
because at the time, like the patient's awake, they're under, moderate sedation, they can hear
Hmm.
you. So you want to do that away from the patient. You want to try to resolve it on your own. They're not looking for just escalation to management. Like we're adults, try to manage it on your own. And then if it does not resolve, if you're a newbie with a preceptor, you go to your preceptor. And then
Hmm.
if not, you go to the lead. If they don't have leads, then you go to the manager. But a lot of people look at that to make sure you can try to resolve conflict on your own
Hmm.
without just going to management. But that if it gets to a point, you are comfortable escalating it to management.
Yes. Yeah. They did have they either asked a question, it was something like that where like give an example, or it was like what would you do in this
Mm-hmm. If this happened.
circumstance? Yeah. So I pretty much did say that. I was like, I mean, if we're in a procedure for the sake of everyone and the teamwork, I'm gonna wait until there's a time to have a respectful conversation. And then if I am in a position where I'm like, okay, it's probably best to speak to my preceptor first, get their advice. And that's what I did. I think when I was new, I was struggling with one of the physicians and their teaching method, and I just went to one. I kind of had like two preceptors. I went to one of them and I was like, I am really struggling with this. Like, I don't know if I'm in a position to be direct with this physician, but I think a
Mhm.
conversation would help. And they were like, I do think they were like, that's just kind of how he is. Like every single person goes through this rut with this person. And I think I then I had my 90-day like with my management,
Mhm.
and I felt like that was a good time. It wasn't big enough to like go to her separately, but then I
But
had
has
that
anything
check
happened
in.
that you're working on or you
Yep.
resolved?
Yeah,
Yeah.
it was like, is there any time where you felt uncomfortable or whatever? And I was like, I feel like I'm doing pretty good. Like I think I'm right where I need to be with the time that I've had. There's been a few things with this physician I'm working through. I think it's going to be all right. But then it's on her radar. And so that way, if I do have a bigger problem, and then I could come to
Yeah.
her
She's
or
not
go
like,
back
well,
to my
you never
preceptor.
told me there was a
Yeah.
problem. They
Yeah.
always love to say that. It's like, I'm not
Yes.
going to run to you about everything. I'll loop you in. And that's how you loop someone in. You go, hey, this happened. Just FYI, had a conversation with them. I think it's resolved, but if it's not, I'll come to you.
Yeah.
And that's how you loop in. You keep your manager informed, but you're not asking them to
Yeah.
do anything. And you're just like, hey, because that physician could go and complain about you because some of them are like that, right? And then the manager's like, didn't hear from you. So it's right of you to go, hey, this happened. This is what I did. We good? Like, I think I took
Yeah.
care of it. But if they come to you, just FYI, this
Mhm.
is what happened. Did you end
Yeah.
up talking to the physician? Did you have a conversation with them?
Yeah. I did.
How did
And
that go? I was just talking to someone about this, so I'm curious if you
well,
want to talk about it.
so this particular physician, I know because it's been shared more publicly that he's got a lot going on outside of work. And
Mm-hmm.
so that for me, like, kind of helps give grace in a sense that, okay, if I just got yelled at for something that was not for moving the II 2 degrees in the wrong direction, like yelled at,
Yeah,
I don't love that feeling because
yeah,
I know I did not cause any harm like to the
yeah.
patient. And in the moment, this actually is like a perfect example for the type of questions they'll ask. But in the moment, I did not say anything. Like in the case, I continued with our closed loop communication. We got through the case. And then after the physician actually apologized to me after.
Hmm.
Yeah,
Growth for
no.
him. I love that.
And that's why like this particular physician, and I actually have a great relationship and good rapport with him now. And I think I did all along, but again, like my preceptor was saying, is like you go through this rut. And not to say that some of the things that I got yelled at for were necessary in me becoming a better tech, but
It just
we
didn't
did,
warrant that reaction. Not
yeah,
that you didn't need to fix it. Just
yeah,
didn't. The delivery was a little rough.
yeah.
Yeah.
So we did end up sitting down after, and it wasn't even really a conversation about like, you disrespected me. It wasn't like that. It was just like, he was like, hey, so I just want to show you what my expectation is with where I like to have the II in the order that I want to have it in. Let's write it down. So he was like, if you
I
could
like.
just write it down for me, what you think is the expectation. I did, and one of them was off.
Mhm.
And so then he was like, let me correct you on this one, and then just ran through the rest of it. And he's like, so there, now you're good. Now we don't need to have any problems in the future. And I was like, okay, sounds good.
Noted.
And
I
then
mean,
from
some
there on
people are
out,
like
like,
that.
yeah, from there on out, like, fine. And then if I am having a problem, like sometimes with bigger patients, you just can't get the II at certain angles. And I'm just like, sir, I got 36 for you. You just ain't gonna get 40. Like,
Yeah.
it's on
But you're
LAL or whatever
communicating,
it is.
I know this is what you want. You do realize
Yes.
why I can't get there, right?
Yeah. 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 And
I
then
only
sometimes
had
you
one
do get
like
that
that.
response of like, okay, that's fine. And I'm like, it's not personal. I mean, he's had 5 add-ons today.
Yeah.
He does a load more work than I probably realize. I think that's like helpful for new grads to know is when you get in, if a physician's short with you and then they tell you don't take it personally, they mean it. Like don't take it personally.
That's them
Because
apologizing, trying to apologize.
yeah, if they apologize, I mean, accept their apology. Obviously, like
I'll remember that for the rest of my life.
yeah, not all physicians will turn around and apologize. So if you get one that does and then they snap at you again in the future, just remember
Yep.
because
And
you probably
sometimes,
don't.
and if you're
Yeah.
taking it personally, do what you did don't take it personally all the time, but sometimes it feels
Mhm.
a little personal. After the case, just be like, hey, was that directed at me? Or like, you got stuff going on? Or like, did I
Yeah.
actually mess up? Or, I mean, that you can't read minds and know what happened before the case that, made them like that. It is a high stress environment that people do get snappy, and snappy doesn't always mean a problem. It might just mean I'm having a crappy day. I'm tired. I know I got to pay attention to everything in this case. And that's why I always said, like, I do have a lot of respect for physicians. I would never want to be one because I can't
Yeah.
imagine giving up that much control on hoping everybody does their job and does it
Mhm.
right. And then I also have to pay attention to what I'm doing and do my job and do it right. Like, that's a
It's a
lot of
lot of
stress.
responsibility.
It is a lot of
Yeah.
responsibility. And then, one little thing here, we all have those days at home
Yeah.
where like I hit my foot on the bed, but it's like I absolutely explode because I'm
Yeah.
stressed about other things. And then I'm like crying, and my husband's like, "What's wrong?" And I was like, "I stubbed my foot."
Yeah.
And I was like, "It's not about the foot, it's about all this other
Yes.
stuff." So I think that's the right way to do it.
Mhm.
Address it head on. And that's why I told a couple people who messaged me that are newer and have issues with new physicians and don't know
Mhm.
them like that. Usually they're not trying to be a jerk. Like, that's not, some people are, but usually that's not their intention. And that was a good learning opportunity for you of you showed him you have interest in doing things the way that he wants. You just needed a little help to get in communication to get there. And he will remember that you made the effort to try to do things the way that he likes. And even when you couldn't get to that angle, you verbally saying that is still acknowledging I was trying to get the thing that you wanted.
Mhm.
I just didn't quite get there.
Mhm.
And that's how you build rapport and respect is
Yeah.
communication.
Yeah. I actually had someone, I think she's still in school, contact me recently, like, kind of like, hey, what should I do about this situation from it was a hard situation. I won't give details just to
Yeah.
protect her, but
Keep it anonymous.
um yeah, but anyway, it was one of those things where I was like, part of it is a little bit fulfilling because I've been on that end of it. So I was able to say, like, it's okay. Like, you're
It
gonna
really
get
does
through
get
it.
better.
It's not the end of the world. Like, I know the cath lab's small. I know that it gets stressed, but communicating and respect can go so
Yeah.
far for you. And so, just take this hump as it goes. If you need to communicate respectfully or professionally, something more specific, start with your preceptor, go from there, like we were talking about. And so hopefully, things resolve for them. But now I'm like, okay, I've been through that. And now I can like hopefully help other people who are stressing about it.
Yeah.
And I have a friend who's going through the program now, and they're a little bit like me where they're like kind of perfectionist, like I want to get it right the first time, and I'm like, you're just not.
Yeah.
You're just
You're just
not
not.
gonna every time gonna get it right the first time, and that's okay. And they know that, and thankfully one of the clinical sites I was at was one where pretty much all of the staff came from the program I went through. So they like
Yeah.
knew what
That's
it was
nice.
like to be a student,
We have that
which is such a
community here.
privilege. Yeah. But I was like, you're not gonna get that everywhere. Sometimes you are gonna have to straight up look at your preceptor and be like, look, I'm struggling to learn from you in this way. I'm a bit more hands-on. Do you think that I could practice some skills after
Hmm.
the case, or could I mess with the inflator after the case? I know
Yep.
that it's not in the body, but at least it would help me retain some more muscle memory.
I
I'm
think
getting off
people
track
are
now, but
always
yeah.
afraid to ask for what they need, but sometimes you have to communicate who you are as a learner and give them some examples of things that would help you, and then put the ball in their court to see if they
Mhm.
can provide that for you. But
Mhm.
that comes off so much better than right not saying anything, because not saying anything can be looked at as not trying,
Mhm.
right? Versus like, well, she did bring this up, she was struggling with this, I can't really find a way to better communicate it to her, can maybe you try,
Mhm.
that with more context and communication, right, you can have a lot more resolutions. Then you can't pretend as a student that people know what you need, because you're right, if they didn't come from the program, from a program, they learned on the job, just usually very unstructured, thrown to the fire.
Yeah.
So they're trying to figure out what you need, right? They don't know. They're like, well, this is kind of how I was taught, and I was thrown into chaos, so I'm throwing you into chaos and hoping we get a good result. until you
Yeah.
tell me otherwise.
Yeah. Yeah.
I don't know. And sometimes
Every
even, the professors don't know either because they were thrown in the fire.
Mhm.
Like, what do you mean
Getting
you can't just figure
like
it out?
yeah. Yeah. I think one of the other questions I asked that helped give me a good picture of the lab and how it functions is what roles would I fill as a tech there?
Mm-hmm.
So
Because it's so
at the
different
lab,
everywhere.
oh, drastically. I've spoken to a few people and they're like, we do everything. It doesn't matter if
Hmm.
you're a nurse or a tech, you scrub, monitor, circulate, um, whatever. So at my facility, things are pretty strict between what the nurse does and what the tech does. And so, like nurses, they nurse, and then we circulate, monitor, and scrub. And the monitor
Hmm.
circulate position is like one position. And so that was nice to know, like going into it, so that I knew that, like, okay, if there's two techs and two nurses, I'll be on every case, and a nurse will be on every other case. But I
Yeah.
will at least rotate back and forth from monitor to scrub or scrub, whatever.
Those are
So
always good things to ask is
yeah.
what is my role? What does my case rotation look like? Because some of
Mhm.
them will be like, well, we have two people who don't, they only monitor. And it's like, interesting. That's a, hmm, certain people get certain privileges, or like, is there a reason that they can't scrub or they just don't want to? Because some
Mhm.
work like that where like people get to do what they want to do. But then as the newbie, they're like, well, you're going to be expected to do everything.
Yeah.
And that's rough, right?
Yeah.
You're like,
There's
wait
a
a second.
facility, like another facility in the state that they actually hire on rad techs to move the
Just move the
table.
table.
Yes, which I
Yep.
think is so interesting.
Yeah, there's a lot of places that do that, which is also good to ask, right?
Mhm.
Because then let's say, I don't know, let's just say you want to be a traveler, right?
Mhm.
That's your goal in life. If your first job and maybe your only job before you travel limits your capabilities, or let's say you work, I've had a lot of new grads who go to New York and go to a teaching institution that has a physician and an attending, and your expectation is you're just going to set the table and like sit and not do anything. If you haven't really perfected your skills yet, you're not going to gain many skills that way. Now you'll be
Yeah.
honest about that, right? But you want to travel later on, that could be difficult for you if it's a competitive landscape of the places that you're trying to travel to, right?
Mhm.
So you want to be mindful of that, and it might make you choose or not choose a job based on
Yeah.
that.
I think it's a definitely a pro to where I work now is I'm exposed to like literally everything and often. I mean, we probably intervene on over 50% of our cases. We just because we cover so much area that a lot of our patients are really sick. So it's
They can't
not
go anywhere else.
it's not abnormal if I'm doing a CTO at 8 a.m. or doing laser
Yeah,
at 10 a.m. again. Like it's
that's
not
good
that abnormal.
exposure.
Yeah, it's
That's good
great
exposure.
exposure. It is. And actually, it's interesting because travelers who come to us sometimes struggle because they're like, oh, I have to get my imaging license and move the table and do the manifold when at my last contract that I did, like, you know, 3 13-week contracts out, I spent the year there or whatever. All I had to do was the assist and I didn't touch x-ray.
Yeah.
So it is hard to transition from one thing to another. So I'm grateful for that. I think knowing your
And
role,
you
knowing
know
the
it's
expectation of your
different other
role.
places. So when someone does struggle or is like, I don't really know this, you don't berate them about it. You're just like, yeah, I know it's different
Yeah,
places. Let me show you,
yeah,
because someone showed me. And
yeah.
it's good to get that different exposure and have these conversations, because if you've only worked in one place, you are OJT, that's your only experience, you're going to get people with variations of experience and understand and have empathy that they're not stupid because they don't know this. That's just their experience. That's
Mhm,
They weren't trained on this. They didn't use Boston IBIS. They used Phillips IBIS, just plug and play. So show them
mhm,
how to do it. Don't assume that your experience is the normal expectation and the normal experience. Like, that's a
mhm,
great thing to strive for. Teach them, show them, but don't say things about them because they don't know.
mhm.
Like, you have no idea what it's like other places.
Would you recommend like to someone who does kind of maybe not a new grad because I did not know to ask these questions, but I wonder moving forward if it would help to ask like what kind of IVUS do you use or do you
Yes,
use shockwave
I
often?
do now. For other people who are interviewing, and then when I interviewed other places, I ask about equipment, or even like clinical sites. When I was evaluating
Mhm.
clinical site, I ask them what equipment they use, and I don't just say IVUS, right? I say, well, which one can you, or if they don't know, can you show me the console? You
Yeah.
know, because it's totally different.
Yeah.
And like I worked briefly at another job, and they had Boston IVUS, and I've used OCT, but I just haven't used Boston IVUS.
Hmm.
And the physician was like, I thought you said you know IVUS, and they opened it, and I was like, I have no idea how to connect this. I was like,
Yeah.
somebody's gonna have to
Yeah.
teach me. I'm sorry. And he's like, you were bragging, you know, IVUS. I was like, I can interpret your image and do all that for you, but this, I don't know how to connect this.
Yes.
And I'm not gonna pretend like I know how,
Yeah.
you know. So it's good. I think not everything, right? Like the FFR, IFR stuff is relatively universal, right?
Hmm.
But some of the nuanced things, right? Are you using a lot of Rhoda, a lot of, Diamondback CSI? I think Shockwave's relatively easy. You don't need to ask about that. But
Yeah.
Impella, are you using more Impella or are you using more balloon pumps?
Yeah.
Right. And you're just like, oh, okay, I need to, and you can tell them, like, I need to brush up on that because we only did one every 3 months or so, but like I'm more
Hmm.
experienced with this, but I'll work on that, or
Hmm.
I know that's something I need to pay attention to and get that case exposure earlier. That also helps them to know in scheduling, right? Like,
Hmm.
what preceptor they put with you with. Do they have someone who's more in complex cases of those equipment gaps that you need? And they can help you, manage that. But they don't know if you don't tell them. And not that I'm gonna decline a job because of the equipment they use,
Yeah.
but just like you asked about staffing and call, it's good to know what your gap is.
Yeah.
So your expectations and your first conversation with your preceptor is good when you get there.
Yeah. Yeah. Then it'd
That's
be
all.
like, oh, okay, well, this is what I spoke about in the interview. I realize
Hmm.
you guys have X, Y, and Z. Can we just maybe spend 30 minutes on each thing
Yeah,
and
like manifold's a
probably
big
get more stuff.
one because
Yeah.
that's like repetition check-offs. Like somebody has to evaluate you. Same with
Hmm.
assist. Those are pretty heavy-handed things to learn that it's good to bring up. Or if you worked at a place that never let you pan, right? Like, maybe
Hmm.
you worked in a state where only a rad tech could do the table, and now
Hmm.
you're going to go work somewhere where you're expected to do, like, techs and nurses do everything. You have to say, like, honestly, my only experience was working at a place where I was not allowed to move the table in the II, so I'm going to
Hmm.
need some practice on that.
Hmm.
That's all. So
Yeah.
and it sets expectations, so when you get there, they have time to process that information. Versus your
Yeah.
first day, they'd be like, "She doesn't know how to pan."
Yeah.
You had the
Yeah. No,
conversation. It's not
we
John.
hire like, kind of broadly, like we'll hire paramedics
Hmm.
or RTs. And so one of our new hires is a paramedic. And so it's just nice to know, like them coming in, we're like, okay, they don't know sterile procedure.
Yep. They
And
need to
it's
do
almost like
boot camp.
humorous. And they're good about it because I just think back to when I got in the program and I'm like, this is totally what I look
Shaking,
like trying
gloving
to put on
yourself.
gloves,
Yeah.
close-handed. Yeah. Um, no, but they're awesome. They're gonna do great. But it is nice to know like kind of, okay, this is probably gonna be a challenge for them. And then
Hmm.
like one of our other new hires was a scrub tech. So they know sterile procedure, but they know like this much about cardiology. So we're like, okay,
Yeah.
we're gonna have to do more educational stuff with them. So yeah,
And you'll
they
get X-ray tech, you'll get a rad tech. Also, I get a lot of rad techs who message me who only worked in diagnostic X-ray. They don't know fluoro. They don't know C-arm angles. They don't know coronary angiograms. And
Mhm.
sometimes someone assumes that they do because they're not asking the right questions. On like, yes, you worked in X-ray, but what did you do? Are you familiar with the C-arm? Are you familiar with this? And they'll be like, yeah, I got introed it in our program, but like not a lot. Kind of like us in structural.
Yeah,
Like, yeah, we learned about structural, but could I do it on my own, like coming in? No. I
yeah,
need exposure to it. So asking those
yes.
questions and just don't have any expectation because even when you're interviewing people as an interviewee, you should ask those questions. Like, what
Mhm.
equipment do you have experience with? Did you use the assist or the manifold? All of those things, because
Yeah.
you need to know what that person is coming in with. Again, not that you're not going to hire them unless you have no trainee people available. You need someone to come in with experience, but you need to know what their gap is, and don't make them feel less than because they don't know when you didn't ask. you know, like,
Yes.
Sam, you don't know Boston Ivis?
I've seen
Nope.
that not go well for that reason. Like someone not asking in like the interview with a traveler and then the traveler got there and there
It
was
wasn't what they thought.
yeah. it was difficult for them to fill the expectation that wasn't communicated. So
Yeah. And that sucks. You know,
yeah,
it sucks both
it
ways.
sucks
I've
for
had a traveler
everybody. It's
reach
awkward
out.
for everybody. So
Yeah.
it is better to
And you
just
don't
kind of
know, like, as the staff, you might assume that conversation happens, so then you're really confused
Mhm.
when that person gets there. And the traveler should say, like, this did not come up, but I'm here now, so please teach me,
Yeah.
you know. And we should, whether they're a traveler or not, like, there is going to be something that someone is not going to know, and you are going to have to show them, or just like, hey, at this hospital, this is how we do this. Cool. Show me.
But
But thank
yeah,
you for being on here and
thank
answering some
you.
questions. I need to
Yeah.
do more of this.
Yeah. I was
But
talking to somebody who said that they went through your program.
oh,
And
really?
yeah, and I was like,
With
I
me?
didn't talk to you yet. And I was like, did you get me a connection to her? I was like, I want to talk to her so bad.
I
I was just
appreciate
like,
that. I love all
so,
my
oh my gosh,
students.
yeah. And then I actually like got my one of our new hires, the scrub tech who doesn't have like a cardiology background. I was like, I know the book for you because she's like, I'm gonna buy all these books. And I was like, don't go buy 100 books. I was like, I
Yeah.
know what you need.
Aw,
And of course she
thanks.
bought that. And she's like highlighting it. She's like in it every day.
It's
So
definitely a visual for I know it's not hands-on, but I tried to make it so it makes sense for people who
yeah.
learn the best from hands-on, which I think us
Mhm.
kinesthetic learners we're usually visual, not
Yes.
not auditory, and we don't like Times New Roman 10 because we fall asleep.
Yeah.
That's that's me.
All my
But yeah, a
PowerPoints.
lot of my alumni are travelers now, which is funny.
Really?
Because they'll
Maybe
be
I'll
like,
meet one of
I'll
them.
talk to someone, and they'll be like, hey, do you know so and so? And I'm like, aren't you in California? And they're like, yeah, because I'm in Florida. And I'm like,
Yeah.
oh yeah, yeah, they're a traveler. I forget. I'm like, aren't
Yeah.
they in Florida? Why? What are they? Would you just meet them on the street in California and be like, hey, I work at the cath lab. How are
Yeah.
you? But yeah, a
Yeah.
lot of they're all great. And I have some people who are traveling who did have limited experiences and are learning while they're traveling. Like I had someone who
hmm
worked in peds, decided to go be a traveler, and she needed to bridge the gap on a lot of the adult stuff.
Yeah.
And she did, and she's fine.
Yeah.
So it's gonna
Yeah.
happen. But thank you so much. If anybody has questions, I know sometimes I forget what it was like
Mhm.
to be a new grad. So please make sure you ask Emma. She does have her RCIS. You can ask her questions about that, about interviewing in a different state and relocation, because that is a whole thing in itself. While you're trying to pass exams and do other things,
And
like you
plan a
really have.
wedding.
Yeah, well, yeah, that I don't recommend
No,
at
I
all.
don't honestly I don't recommend my path, but I'll answer your questions if you
But
have.
sometimes it's not. It's the hand that you are dealt,
Right.
and you just have to figure it out. But that's what
Yeah.
is great about social media is you do have resourcing. Somebody with something similar. But thank you so much. I will post some of this if it saves, and I will
Okay.
send it to you. Okay.
Sound good. All
Have a
right.
good day.
Thank
Happy
you.
Monday.
Happy Monday.
Bye.